Okay, so for this first muscle group, what we're going to be addressing is the more superficial muscles of the back, and in this case we're going to be talking about the extensor system. And the extensors, we have three of them. We have the spinalis, we have the longissimus, and we have the intercostalis. So this is a very strong, powerful muscle group, has a lot of neurological intervention. It's very critical for us to treat because it goes the duration of the spine all the way up to the top. Now, when we start to position the person for the extensor treatment, just a couple of things that we have to be aware of. We have to be aware of, first and foremost, whether or not somebody has intolerance to the position of extension. That is where if somebody starts to extend their spine, they feel pain, they feel increased guarding or threat. Some people cannot lay comfortably on their belly while especially you're doing this treatment of these muscles, because by pushing down on them, remember laying face down, they're already in a degree of extension in the lumbar spine. And if you push down harder on them, you're pushing them into more extension, and that can trigger a threat response. It can cause somebody to tighten, and that's going to reduce the effectiveness of our work. So one of the things that's very helpful here is using a massage bolster, pillow, couple pillows, and letting it, the placement be determined. First and foremost, it needs to be under the pelvis, but allowing the person to adjust it up or down to give them the greatest degree of comfort. And again, it can always be adapted or adjusted based on where we're treating, okay? So if they feel like they need more support when we're pushing in the L3 area, you can always adjust it. Again, there's no rules on having to set something in one position and it has to stay there. We can move it however we like. The next thing is the position of the feet. Some people feel comfortable with their legs going straight out. Some people are going to need an additional bolster. So in this case, we'll allow him to have his legs straight out, but you can feel free to put a bolster underneath the legs as well, and that might provide some additional comfort. So remember, at the end of the day, the most important thing that we've got to accomplish here is getting somebody into a position where they feel most relaxed, most comfortable, so that when we begin our treatment, we can reduce threat, we can reduce guarding. And the more of that white noise in the background that we can eliminate, the better it's going to be for our therapeutic session. So, in starting with the extensor system, after thoroughly reviewing the anatomy, which we should do, we've got to be aware that these muscles are going to start all the way down on the sacrum. Okay, so they don't finish at the lower lumbar spine, they go down to the sacrum. They run in strands going all the way up to the attachment on the bottom of the skull here in the cranium, okay? And these fibers are going to start to move out laterally, especially when we get to the lower thoracic region as we get into the iliocostalis. Trigger points oftentimes appear throughout the muscle, and they can refer downward predominantly. So as we start to push into this area, let's say in the T10 area, you might feel referred sensation going down into the lower ribs. Trigger points in the lower lumbar erectors will refer down, oftentimes on top of the sacrum and into the sacroiliac joint region. So it's important to make sure that we identify any areas where there's increased sensitivity, and we can always go back and treat them. So as we begin to do this work, we are going to take a global approach first. We're going to use a lot of elbow glides going up the tissue and then going down the tissue. And then we'll go back and more specifically re-examine all the individual areas. So in keeping with our communication with our client, we're always going to be talking about our number system. So on a 1 to 10, a 10 being if you hit a spot and they almost feel like they're jumping and it's very intense. Okay, we want to keep our general level of therapy to around a 6, maybe a 7 for people that are used to a lot of therapeutic work on their muscles, especially in this area where people tend to like deeper pressure. So the first thing what I'm going to do is apply lubrication. And again, as always, we want to make sure that we do not over lubricate, okay? Because what it's going to do is create an oil slick. We're not going to be able to access deeper tissues, so we have to be mindful of that, okay? So we want to apply our lubrication going all the way up, but I like to have it just enough where I can get a little bit of friction on the skin as well. Now, because of the length of these tissues, okay, what we want to be mindful of is how long that glide is going to be. Okay, I'm 6'3" and I have a long stance, so it's going to be easier for me to do a larger glide, even though I'm not going to, because we're going to start to lose effectiveness in the stroke as we start to get ourselves to the end of the range here. It's better off to choose a section where you can treat very effectively and thoroughly, reposition your body, and then treat the next section. Because that way, as keeping with our founding principles here, we want to be very thorough and precise with our treatment of these tissues to make sure we cover everything that's necessary and we don't miss anything. So elbow placement here is quite simple. We identify our spinous process as low as we possibly can, and we can identify the PSIS, which is the posterior superior iliac spine. Okay, and the point between those two is going to be roughly the beginning of the iliac crest, and that's where we can place our elbow. It's very important that we don't place the elbow on the spinous process and then we're running over the spine like a speed bump. That's very uncomfortable and it might cause damage to the tissues on top. Okay, so we want to make sure that we position ourselves correctly. Now, just a reminder here, before camera angles and so forth, you might see that my ergonomics are not perfect, but I want to make sure I stay out of the way of the camera. But this is how we're going to start. As we make contact down there into the soft tissue section, there's my spinous process. My elbow is just lateral to it because we want to start as medial as we can to affect the spinalis. Now, when we start to put pressure down, I'm going to caution you against pushing straight down to the table. Because as we push straight down to the table, we're putting a lot of extension force into the lower lumbar spine, and oftentimes that's very uncomfortable for some clients. So I urge you to start by pushing at a 45-degree angle. So if I start to push at a 45-degree angle, it's going to be much more comfortable, okay, and we'll be able to treat our tissues just as effectively. Don't worry if we start to miss some of the deeper tissues at the attachment point down here on the iliac crest, because we are going to go downward as well, so we can make sure that we hit those in that point. Okay, so I'm going to push down, and as I get to my tension point, where the person is roughly at a 6 on the intensity scale, I'm going to glide straight up. Now here, just because of the length of the stroke, I'm going to stop at approximately mid-thoracic region. I lift up my elbow, I reapply again, down 45-degree angle, and then push, keeping close to the spine as I'm gliding up. Now my my forearm is perpendicular, okay, to the ground, to the vertical position. I'm not driving in with the pointy part of my elbow, okay? So I'm making good flat contact with the extensors. And the amount of glides that we're gonna do is depending on the individual. I would say we're gonna get at least 5 glides, but you can do much more, depending on the comfort level of the person, okay, how used to therapy they are, and how the tissue is, of course, responding. So as I glide up, I maintain that downward pressure, okay, I don't lighten up as I get up there unless the intensity is too much. Once I've got my 5 glides, I'm gonna go back to the beginning point. I'm gonna move laterally just a little bit, because as we talked about, those extensor fibers start to move outward to the side a bit as we start to get to the longissimus and the intercostalis. So again, pushing down, okay, and gliding straight up. And here we're going to be a little bit more lateral, getting a little bit of twitching going on as I hit certain areas. So those are going to be areas that we're going to want to go back and do a little bit more assessment on and a little bit more specific treatment of those tissues. As I keep gliding up, okay, you can feel the fibers underneath the elbows, so you can kind of start to rotate the forearm to kind of chase them toward the shoulder blade, okay, if that's the way that the person's anatomy is. Okay, and as we've gotten about 5 repetitions, if you need to go more laterally, you could do a 3rd glide. In this case, I have a lot of forearm here, and the way that I was positioning, I got the majority of his extensors, okay? If you need, again, to do that 3rd glide, you may do so as well. So once we've done that, we've been able to flush some blood into the tissue, okay? Reduced sensitivity, reduced tenderness, and now we can go back and assess the tissues, okay, more specifically. You also have the option of going to the other side and then doing your glides going up. There's no rules on this. You can treat one side and finish it, or you can treat one side, treat the other side going up, allow this area to calm down a little bit, and then come back and treat this side as well. Okay, but for the purposes of our demonstration, then I'm going to stay on the same side that I just did my glides up on. Now, when we go back and we treat the individual tissues, what we're going to need to be aware of is that there's so much neurological connection here, okay, in the spine that we need to deal with each section of the erectors as almost specific. Okay, this is in particular important when we're dealing with cases like scoliosis, because each area might have certain curves in the spine that need to get a little bit more treatment in some areas than others. Okay, so we always want to go back and be more specific. Now, when you do your individual treatment sections, we're going to locate our anatomy at the bottom, the same place that we were previously. Now, in this section, what we want to be doing is we did our vertical glides. We can come in here and we can do some cross fiber manipulation. So in this case, we have medial to lateral and lateral to medial. So what we're going to do is we're going to start medial, and then I'm going to flip over the fibers moving in a lateral direction. And again, the repetitions on average is going to be about 5. You can certainly do more if the case is necessary, but 5 is usually going to be a good starting point. So I identify the L5 process, okay, spinous process. My finger is going to wrap on the inside of the spinous process. My hand is over here for support. Now we want to make sure that when we do cross fiber gliding here, that we're not just scrubbing the skin over the muscle fibers, that we're actually pushing down, making contact into that tissue, and then moving it laterally. Okay, so almost thinking about stretching the fibers in a lateral direction. Right? I push down and I glide laterally. Okay, I'm going to give 5 repetitions in that section. Again, making sure I'm staying below that threshold of about a 6, maybe a 7, depending on the person. And after I've done my 5 repetitions, I identify the next segment up in the spinous process. It's right there. Make my contact, push down, glide lateral. Okay? And we repeat our process for 5 repetitions. Again, always in communication with the client to find any areas that are increasingly sensitive that we may want to go back and do further therapy on, okay? Add additional techniques, whatever is necessary. So as we do our 5, we're going to continue this process going up the spine. Nice twitch response right there, so that's going to be pretty tender. Okay, next section. And as I'm doing this, you can see the process, just repeating it and being very thorough, one thumb at a time. One thing that I also want to make mention of here is that your table height is going to be very important. This table is a little high for this particular technique. So luckily I have an electric table. I can lower this down without having my shoulders shrugging up. But again, for the purposes of this video, this is what we're doing. So as we keep going up, we're going to find more tissues that are eliciting sensitivity, okay? Because oftentimes these fibers are a little thinner than they are in the lower back region. So they're much easier to identify tenderness with the thumb, especially doing the cross-frictioning, okay? And I'm going to continue this process. Now, we never use a thumb glide, or actually, apologies, a elbow glide up to the neck or the skull, even though the extensors are attaching there. We are going to stop at roughly C7, T1 region, okay? And then the extensors of the cervical spine are going to be dealt with when we go into the cervical therapy routines, okay? And that completes that. Now what we've done is we've done our inferior to superior glides. We've gone back and treated the individual tissues. Now the final treatment here is to do a downward glide, okay, with our cross-frictioning afterward. So again, we'll apply just a little bit more lubrication so it's comfortable, okay, especially toward the top. I'm going to reposition myself, elbow just inferior to C7, T1, okay. Now, because of the shoulder blade, I might have to rotate my elbow just a little bit to initiate my glide here. And then as I pass, I can rotate it, okay, by internally rotating my arm back into that flat position so that we're perpendicular. We glide all the way down until we start to feel that iliac crest. Okay, make sure we push down at a 45-degree angle, not down toward the table, and that's going to be very comfortable. Okay, again, we're going to start that process of 5 glides, going as close to the spine as we can without running into the spinous process. And oftentimes you're going to find, when you're communicating with your client, that downward glides are oftentimes much more comfortable than upward glides. There is a reason why we treat in different directions, okay? And it's a different source of stimuli, and it can reveal things in one pattern or direction that the other direction did not. So make sure that you do glides in both directions to fully treat the tissue. And we'll get one more here. And again, going in the downward glide, you may need to do a couple of lateral steps. Now again, at the top, we do not need to do more lateral. Okay, so I'm going to hop down a few levels, okay, so that we're approximately the T6 level, and then I will start that next glide going down. Okay. And watch out, as always, in the next section, which we'll be particularly talking about this with the quadratus lumborum. Make sure that you're not putting too much pressure down into the 12th rib. Okay. That's very uncomfortable, and you don't want to create a potential disaster. So be very mindful of that. Okay, one more. There we go. Okay, now we can go back, and as we examine these tissues, on the way up we went medial to lateral. Now we're going to go lateral to medial. So we again identify the C7-T1 region, and we're going to start back by grabbing those lateral fibers of the extensors, okay? And then we're going to flip over them going medially until we feel the spinous process. Okay, again, always examining for tenderness. One thumb width down, we continue. Next section, again, hook onto the lateral side of the extensor as you glide straight medially. Okay, again, not just flipping skin over the tissue. And as we continue this process, and make sure that we don't skip anything, and we're being very thorough. Tissue is going to get heavier at a certain point through that mid-thoracic region. Okay, and we're almost done, but you're seeing this essentially in real time. This is exactly how we go through this process, with more communication though, because I'm saving that a little bit here, but we're always talking and saying, is this tender? What number is this? Okay, so we can get an idea of what is tender. There's my last section, 5 repetitions, and done. Okay. So now, again, recap, we did our glides going up, medial to lateral. We did our cross-fiber frictioning, okay, going medial to lateral, all the way up. Then we turned around and we went from superior to inferior glides, okay, and then we went lateral to medial cross-fiber frictioning. At this point, okay, the tissue's got a lot of blood flow in it, had a lot of stimulation, okay, as long as we didn't do too much, we should get a nice relaxation effect of the tissues. At this point, I would go to the other side, okay, if you have not been alternating, which you could be at this point, which is fine, to make sure that you treat the entire other side. That's going to allow time for this blood flow to get in here, to clear out metabolic waste, to desensitize the tissue. And then when you come back to it again, you can go back and examine any specific tissues that were previously sore. A technique that can work out there is ischemic compression. That's where, let's say, we had increased soreness roughly at, let's say, T12 L1 in the extensor right here. I would push down, okay, until I get to a stimulation point of, again, 6 or a 7. I would hold static pressure, okay, and then telling the client, let me know when this starts to diminish. That static ischemic pressure by now should release much faster and more readily after having worked on the tissues, doing the full gliding and cross-fiber procedure. When the person's relaxed, this is going to feel like much less stimulation than the previous. So as we do that, we make sure that the person restores normal breathing. So as I push down there and I get that 6 to 7 stimulation, I tell the person, just take a deep breath, exhale, relax. Let me know when that sensation drops a few points, maybe a 5 or down to a 4. I can feel it releasing underneath my fingers, okay? So we're ready to move on to the next area. And you can repeat that on any individual sections as necessary to reduce the perception of stimulation, reduce sensitivity of trigger points in any areas that need to be further addressed that you found throughout your treatment. So that is how you treat the extensor muscles.